Hey guys, it's Dr. Justin Marcagiani here. Today's video is going to be on the coronavirus death statistics. Should we be concerned? Again, I'm going to break it all down for you here. So first off, there's a lot of smart people that are putting statistics out there that are CDC or World Health Organization, confirmed. And I think a lot of people are getting scared by this. It's creating a lot of hysteria. So I'm going to break it down, relatively speaking. We have to compare it to something. We have to compare it to flu or other known infections. That gives us comparison. People say you can't do this. I disagree. We do it all the time when it comes to previous viruses and previous infections. We did it with MERS. We did it with SARS. We did it with swine flu. We did it with Ebola. We do it all the time. So we have to have a frame of reference, okay? So first off, let's look at how many people in the U.S. actually have the coronavirus. So first thing first, you're going to see in the U.S., we have 68 deaths in the U.S. The mortality is 68. And if you look at the number of cases, it's 3,667. So 68 deaths, 3,667 cases. Keep that in the back of your head. Now, this is flu. So flu, we have about 222,000 total cases. So you can see here 114 are influenza A, 108,000 influenza B. These are confirmed actual flu cases, okay? And then typically 22,000 deaths per year of flu on average. That's an FYI. I'm going to summarize all these stats for you. I just want to look at it. These are all CDC approved statistics, just so you all know. All right, now this is really important. So this column here, we are looking at seasonal flu, coronavirus, and then coronavirus globally. And these are all from the Worldometer, which is one of the big websites that's keeping track of all the coronaviruses as of today, March 16, 2020. So overall, we have 22,000 number of deaths per year of seasonal flu. We talked about that, and 222,552 cases. Now, this is important. So if we just do the 22,000 divided by 222, guess what the death rate is? That's a 10% death rate. Now, why aren't we hearing flu having a 10% death rate? I'll break down why in a second. And what we're hearing of coronavirus, we're hearing about like 3.4% coronavirus from the World Health Organization worldwide or in Italy. Globally, when you do the number 6668 divided by 173, it's about 3.8% and change. We just rounded it to 4 to make it nice and round. So that's, if we just do the incidence, the number of deaths divided by the incidence, it's 4% globally for coronavirus. If we take the U.S., 69 divided by 3806, it's about 1.8% coronavirus. We rounded that up. Now, the problem is, in statistics, you're not going to ever be able to test the entire population. That's the problem. So we do statistical regression analysis to assess how many people we think have the coronavirus or receive the coronavirus in the United States. The problem is we don't have enough testing here. So if you look at number of people tested for coronavirus, due to the shortage in testing, we don't have enough data. We only have 3,806 people tested, okay? Now, when it comes to the flu, it's different. We have over 1 million people tested for the flu. Now, from that, we can do statistical regression to figure out how many people we think got the flu. And that number becomes now 36 million. So now when you take the 36 million number, well, that's a lot bigger. So when you take the number of deaths and you divide 22,000 divided by 36 million, now we get the 0.1%. This is the number that everyone hears. It's the 0.1% number. And the reason we got to the 0.1% is we did statistical regression to figure out how many people we think overall received the flu in the United States. Now, a coronavirus, due to testing, we don't have enough of those numbers. Therefore, we can't do statistical regression to assess the overall death rate. And then, of course, worldwide, we have 173,000 confirmed cases. I'm going to guess 173 plus 6,000. I think we have maybe 180,000, 180 plus thousand cases, people actually tested. So we don't have enough data. We need over 1 million to really run a good statistical regression to figure out how many people in the whole world have it, let alone in the U.S. So I just want everyone to kind of understand big picture. The reason why this number, the 2 and the 4%, are a lot scarier is we haven't run the statistical regression on how many people totally got it. Now, why is that important? Well, because 80% of people who get the flu or get coronavirus, guess what? They're going to show mild to no symptoms, meaning they will not get tested. They will not show up in the incident data. If they don't show up in the incident data, it makes the mortality rate seem higher. Mortality rate seems higher, people get scared. There's hysteria. So I want to take away the fear. The numbers probably aren't as bad. I think it's going to be worst case, it's equal to flu. I think it's going to be somewhere between 50% below flu. That's just my gut instinct, knowledge guided by experience, just looking at the numbers and comparing it to flu and previous epidemics. I don't think it will be spread as far. I think a lot more people have coronavirus than we know. Lots of reports of people in the last month having flu-like symptoms and not even coming down with flu. I mean, there's a lot of other flu-like viruses, right? You have adenovirus, you have various rhinoviruses. So there's other viruses out there that can cause flu-like symptoms. And it may not be flu, it may not be corona. So keep that in the back of your head. So we need more testing. As we get more testing in, I think you're going to see the death rate in corona drop significantly. So I want to just take away the hysteria a little bit. And also, who should really be concerned? I mean, if 0.1%, if this is the number, I mean, really, if we look at the data, it's the comorbidity. If you have a comorbidity, meaning a pre-existing disease, cardiovascular disease, diabetes, respiratory issues, hypertension, cancer, your rate of having one of these infections is going to go up tenfold, right? So you're going to have tenfold plus risk when you have a comorbidity. So even if you're thinking, hey, this 0.9% is scary, it's really 10% above that, okay? And then again, when you look at the whole entire country, it's actually down to 0.1%. So just kind of keep that in the back of your head. I don't want people to get scared. I want to use data to kind of get people to understand. I don't think people are lying. They're just missing information, and that information is a vital portion of where we should be in regards to our emotions and fear. And when you're not as fearful, you get that frontal cortex involved. You're thinking better. You're out of the fight or flight. You can still do safe things like social distancing, drinking enough water, getting enough minerals, doing a lot of the immune support and nutrient support and diet and lifestyle support I've talked about in other videos that we'll link down below. So I want to make sure everyone's empowered. Don't get confused or don't get fall into the hysteria with the so-called numbers. Just kind of want to draw some inference here. Now you guys are being more empowered and you'll be more in control of your emotions. Hope this helps. Again, this is Dr. J signing off. Make sure you subscribe and click down below as well. All right, take care. Bye now.